Hello, everyone. Thank you so much for hopping in. My name is Ransom Anima. I'm a final year radiography student, a medical writer, and also a YouTuber. Today, I have an amazing guest speaker for mental, chats. Her name is Dr. Janet. Um, I'll give her the pace to introduce herself. So, Dr. Janet, could you introduce yourself to the audience?
Yes, so hello everyone. My name is Dr. Jeanette Olorunniwo. I am a resident doctor in the UK. I did my training here and I've been working here for the last few years. And towards the latter part of my foundation training, I developed an interest in digital health and digital transformation in healthcare. And so I'm still working in clinical practice, but I'm pursuing how we can um, implement and leverage digital tools in clinical practice. And so that's what I'm exploring at the moment, alongside working in acute medicine and emergency medicine.
Amazing, amazing, Dr. Janet. Thank you so much for introducing yourself to the audience. So let's proceed to the first question. All right. So what really inspired you to go beyond clinical medicine, and diving into digital transformation and global health in general? Talk us through.
So I think for me, it started with my own experiences working. Um, and I think I saw firsthand how digital tools and leveraging digital tools can improve our experience as clinicians, and that in turn improves the patient experience. I worked initially, my first job was in a hybrid trust where we worked with electronic tools, but we also worked and pen. And I, from that experience, I just experienced a lot of the pain points that you hear commonly from clinicians, that we need to move on, we need to keep pace with technology, because paper and pen was slowing us down. And so again, firsthand working in that context, I became interested in, okay, what specifically are the ways that we can leverage technology to improve the way that we work? And how can we use that to sort of shape our experiences as clinicians, and then also on the patient side of things? And so I went on a deep dive, essentially, engaging with networking opportunities, industry events, conferences, to learn more. How are people implementing these tools? What have their experiences been? What have some of the challenges that they've been facing in integrating that into the systems? And so that is where my interest started from, and that's why I've spent, I'm balancing more of my time between, yes,
How we
web
can
work
web
using.
work using. Amazing. Thank you so much, Dr. Janet, for that one on what really inspired you to go beyond clinical medicine and diving into digital transformation and global health in general. That was amazing. So talk us through, you know, what do you think is the situation of UK's healthcare system right now in towards your transition from clinical medicine to digital transformation in global health? Is it benefiting you with the current UK healthcare system right now?
That.
Getting it. Oh, so sorry. With the health UK healthcare system right now, currently, how is it benefiting you with your transition from clinical medicine to digital transformation and global health?
Yes. When you look at the healthcare landscape in the UK, there is a big push towards increasing uptake of digital tools in the way that we practice, from primary care, through to inpatient settings and secondary care, and beyond that. Digital tools are being implemented in patient communications, in community engagement, and so I think if you're someone who is interested in learning, how these tools are being implemented to solve some of the common problems and to provide solutions to those problems, you can see it firsthand. NHS England recently underwent a major reform, where they shut a lot of those departments down. But beyond that, the NHS has branches dedicated to digital health, where they release recommendations, and with a lot of the clinical safety guidelines, and so there is a big push just generally towards digital health, because you just have to look around you. The world is changing, the world is becoming a lot more technological before our eyes. Within the last few years, AI has revolutionized a lot of the way that we work beyond healthcare, just in society as a whole. And
And
the
the
the onus is sure that
changes keep
keep in line with.
amazing because I've been seeing a couple of doctors in the UK leaving the NHS to go to another countries to practice, or another you know maybe hospital to practice in the UK. So yeah, thank you for talking us through and how the current UK healthcare system is really affecting you positively, in terms of your transition, from clinical medicine into digital health and global health in general. So that draws us to the next question for you, Dr. Janet. How are you currently using digital tools to improve patient care or healthcare systems, especially in undeserved communities at large?
I would definitely say, for me personally, it's been a lot of quality improvement. That's the nature of the work that I've engaged in, to provide evidence and data, to support, um, the push towards implementing digital tools and digital solutions. So like I said at the start, I worked in my first job, I worked with a lot of paper-based documentation, and so that spurred me on initially to engage in quality improvement projects, to provide evidence to show on a trust-wide level how, if we shift towards digital tools, we can improve um, the communication between departments, we can improve the communication between specialties, between levels in the healthcare team, amongst the MDT, if we adopt electronic solutions and tech solutions for the way that we operate in clinical documentation, that can improve, in terms of time. It reduces inefficiencies. It reduces discrepancies because of um, you know barriers in communication, and it just makes things a lot more seamless. And so the projects that I've undertaken have made the evidence clear as day, that opt for um, if you opt for digital solutions in terms of clinical documentation specifically, the improvements across the board are very, very evident.
Amazing. Dr. Janet, I'm a bit curious about something. You like you mentioned about you were when you were working in the clinical, medicine department. You mentioned you were aware of the paper-based, documentations and all that. So talk us through. This question prompted. I had an amazing guest speaker who, created an app, to checkmate people's, like, for instance, the Flow Health app. The Flow app, that checks the women's periods and all that. So do you think that such transition, that the word right now is moving into that digital health transformation currently? Do you think that the word's current situation right now is diverging into digital health transformation in general?
I think that
You
in
look
terms
at
of secondary care, we
secondary
have
care.
away, like I mentioned, we're moving away. It's still in the process, it's still quite slow, but we're still undergoing the process, and we're moving towards electronic patient records, electronic medical records. And then you look in community care, for example, and like you mentioned, the Flow app, that's a very predominant one. And aside from the Flow app, in the NHS, there's now the NHS app, which has been developed and been released to the public. And there's been a lot of good feedback from patients about that. And I think the shift towards these tools, apps, namely, like we've mentioned, has shown that if people feel empowered to engage with their healthcare, um, it takes the locus of control away from solely their care providers, and they feel able to be more engaged with, with their health and with their well-being. You look at other apps like Strava, for example, that encourage people to get moving, encourage people to modify their lifestyle by engaging more with exercise, with running and cycling, these types of things. It has definitely, the evidence is clear that people feel able to engage more with their healthcare because it's the ease of access has been heightened. I don't need to wait, for weeks before I see my GP before I'm getting results. Now I can get them at my fingertips through my phone. So I think even just in terms of accessibility and how people feel empowered to engage with their healthcare, these digital tools have worked wonders, in my opinion.
Amazing, Dr. Janet. Thank you so much for that one. And I believe that people out there really lighted on how digital tools are improving patient care in general. And also thank you for telling us through how you use these tools, during your practice, to improve, healthcare systems, patient care, especially in underserved communities at large. So the next question for you is, what challenges have you faced navigating both the UK's healthcare system and the global health landscape, and how did you overcome them?
I think for me, it would be in two folds because I've worked directly as a clinician in the UK, and all the work that I've done in healthcare outside of the UK has been not necessarily directly patient facing. So in the UK, like I mentioned, some of the challenges I've faced, is a common pain point among clinicians that when you are um, when you are trying to give your best and trying to be attentive and present with the patient, it can be hard when you also have to divide your attention with documentation, and you have to divide your attention with admin, and there is a very significant administrative burden which you can't really circumnavigate because it has to be done. It's part of the work. You have to document and you have to make sure that you're on top of the admin. So I think on that side of things, that's a challenge that I have had to navigate firsthand. But I have also seen how, again, digital health has come in to the scene and revolutionized even that. So there are now, AI scribes, ambient scribes that work alongside clinicians to make sure that that administrative burden has been alleviated to some degree. It's still, being developed, it's still being refined with time, with feedback. But there has been, significant improvement on that front. And I think in terms of global health, some of the challenges that I've faced personally has been predominantly with accessibility, um, especially when you look at rural communities where not everybody has access to a smartphone, not everybody has access, direct access to the internet. You really have to sit down and think, okay, how are people in those conditions going to benefit from some of these interventions? And you have to be quite adaptable. And that's why I'm particularly grateful for telemedicine, because it's really made a change in that context. Again, unfortunately, everybody doesn't have immediate access to these smartphones and devices, but telemedicine has you know provided a solution to that. So if you can't get directly in front of a care provider, you can go to some of these health hubs, where you can access care, and it's reduced those barriers to access. And so that's another way that digital health has that we work,
With
those rural and
people in those rural and underserved. Amazing. Dr. Janet, thank you so much for sharing, talking us through on how, the challenges you've encountered, both in terms of navigating both the UK's healthcare system and the global health landscape and how you overcame them. That drew me to the first question I asked about the current UK's healthcare system and how it's, if whether you're benefiting from it based on your transition or not. But thank you also for sharing on how the UK healthcare system is currently, impacting you positively. So we have one more questions for you to proceed. But before we proceed to that question, what advice do you have for doctors out there that's trying to like navigate doctors, because there are so many doctors out there who watch this video that are looking forward to diverging into digital health. What advice do you have for them?
I would give them the same
Um,
and you are trying to explore different branches of medicine aside from the traditional routes. And so, valuable advice that I was given that I would share to people in that similar boat to me is attend as many networking events as you can, attend as many conferences around your area of interest as you can to expand your knowledge, to give you exposure to what other people who have gone before you are doing. Anything that piques your interest and you want to find out more, I would definitely utilize platforms like LinkedIn and social media to connect with those people, to figure out, okay, how did you navigate the ambiguity of pivoting from clinical medicine to your area of interest, be that digital health, be that lifestyle medicine, preventative medicine, or beyond. If you're interested, for example, in the more business side of things or the medical legal side of things, then find out who are the key players, who are the thought leaders in those spheres, and reach out to them, try and engage with them. If they have any events that they recommend, attend the events. If they have any, reading resources, wider reading that they recommend, pursue that. I would definitely say connecting with people is such a valuable bridge between where you are now and where you're trying to get to. And that's, from my experience, that's what I've
From my
seen.
experience, that's what I've seen.
And
And
like I say, I'm still on the process. I'm still on that journey. So, connecting with people has definitely helped me along that journey.
on that journey. That nugget for doctors out there, watching this video, trying to pivot into digital health. So, how about for medical students out there, interested in this, space? What's one practical step, they can take, today to start building a similar path?
For medical
For
students,
medical students,
one practical step
one
that in finding their path, I think is very similar to the advice for doctors. Who are the people that who are the people in your purview who are doing similar things that you're interested in, and try and align yourself with those people, connect yourself with those people, and find out, are there any projects that they're working on, anything interesting that they're undertaking at the moment that you can shadow and you can learn from, any support that you can provide to them, administrative support, or just position yourself as someone who is very interested in learning more about their journey, learning more about the field. Demonstrate your interest by putting yourself forward. You have to put yourself out there, which is, again, another valuable piece of advice that I was given. It's important to make your face known, make your voice heard, and say, I'm interested in learning more about this, and you seem like someone who is actively in that field. Can you point me in the right direction? Can you share any of your valuable knowledge with me? I think it's the same, for medical students,
same, for medical students,
people,
people, um,
really
really
in where
being where.
to get to.
Amazing. Thank you so much, Dr. Janet, for your time today. We've been having some backlashes in terms of bringing you on this session because of your work schedule. Um, so in a nutshell, if you're also wanting to connect with Dr. Janet, her details will be on the YouTube description below. So if you have questions, you can reach out to her and as well connect with her as well. And make sure if you have questions, you can drop in on the comment section. And if you love this content, do well to like share comment, and share to your network as well, to improve more, knowledge spread across our horizon. So thank you so much, Dr. Janet. That was an amazing session. And I believe that the audience are really enlightened more. So thank you, Dr. Janet.
Thank you.
Thank you.